Hello, welcome to my student support system. In today's class, we are discussing a very important topic, that is health assessment. And under health assessment, it is part 1 lecture of health assessment where we will discuss about history taking. Next part we will do in another lecture. This lecture is in English, and if you want to study in Hindi, just click on I button and you will get link of Hindi lecture, or you can directly visit to channel My Student Support System. What is health assessment? Health assessment is a process of identifying the specific health needs and level of health status of a person. Basically, health assessment involves two steps: history taking and physical examination. So, in today's lecture, we will discuss part 1, that is history taking. History taking can be accomplished or completed in any setting, be it a hospital where client comes or in community where we go for home visiting. History taking is a part of health assessment which involves asking specific questions to the patient or to the person who knows the patient very well and can give suitable information about patient and his health status. History taking is also known as interviewing of the patient. What are the objectives of history taking? Why should we take history? Number one, to establish rapport with the client. Because when we are talking with the patient, an IPR is developed and it will assist in gaining confidence of the client. To establish and maintain nurse-patient relationship for proper nursing care, and to obtain information which will be useful for diagnosis, and to identify or clarify health problems, to give information to the client or to teach him or her about health, and to counsel or assist the client in finding solution of the problem. So with these all objectives, we go for history taking. What are the principles of history taking? Actually, history taking is very, uh, we can say, complicated as well as intelligent process. The interviewer should have thorough knowledge of the communication and IPR. Whenever we start history taking, we should use certain principles, and we should always keep in our mind these points, that we should start the history taking or interviewing by sitting, not standing, or just when we enter to the home of the client and start taking history. That is not proper. Sit facing the client, because sitting suggests relaxation and indicates that time will be allowed for the interview. We have sufficient time for the client. This message is conveyed by just sitting with the client. Provide privacy. Try to sit one to one during history taking. At certain points in history taking, like when we talk with the family, that is family history, then we can ask for family members to come with the client. Otherwise, one to one history taking process should be done. And attend the client's comfort. You should see that client is sitting comfortably. No anxiety is seen on the face. And for providing comfort, you can supply pillow or support, a footstool, or a glass of water. Use simple language at first. When we start the interviewing, start from easy and then you can proceed for complexity if the client is able to understand. Explain the purpose of the interview. Always explain, because otherwise client may not give the information that will helpful for the proper diagnosis. So always explain the purpose and how long it will last and how the information will be used. Everything should be clear to the client. Use narrow questions to help the client to focus, such as, do you have nausea with vomiting? Then the client will think and give proper answer. Use open-ended questions such as, how do the headache begin? To explore feelings and perception and to identify the areas which require follow-up. Look and listen carefully. Always maintain eye contact with the client. Use verbal as well as non-verbal communication. Establish eye contact and avoid answering to the client for the client. Just give question. Let the client think. You should not suggest the answer. And explore the clues that done in a non-threatening manner. Avoid interruptions and the appearance of being distracted or bored, such as looking at the clock. Then it will suggest that you are not interested, you are getting late. Then client may hide some information. So looking and sometime when continuously you are looking at the phone and talking to the client. So these are distractions you should avoid. And sometimes silence is also helpful. If silence is there, then it will encourage the client for thinking and often produce verbal responses. After these settings, now you are ready to start the process of history taking. Start history taking by collecting personal data first of all, such as date of interview, name of the client, gender, date of birth, place of birth, age of the client, address, and person to be contacted in an emergency. Write the name, relationship, address, and phone number. Then you can also write the education of the patient, occupation, presently he is working, or if he is retired, then what was the occupation before retirement. This we can ask as starting personal data or identification data. Now we start present health history. And in present health history, what we try to get information, what we ask. First of all, we ask for present problem. Why the client has come here, or if we are visiting the client, then simply we ask, at present, what problems are there you are facing related to health, and what was and when the onset of problem, the day or the time, location of the symptom, where it is hurting, abdomen, headache, etc. Then chronology. If a lot of symptoms are there or events are there, then we ask for chronology, when the first symptom was there, when the second, in this way. And precipitating factor. What are the factors which starts these symptoms, or which motivates, or which uh, generates these symptoms? Those are known as precipitating factors. We ask the client that what are the precipitating factor, what are the things that leads to particular symptom such as headache. We also ask alleviating factors, that after starting the symptom, how it subsides, when it subsides, what times it takes to subside. Aggravating factor, if the pain increases, then what the factors are there which aggravates. Associated symptoms. What are the associated symptoms with main symptoms? Then we can ask to apply. Then treatment he is taking currently, and we should also ask the client's view for the cause. What client is thinking about that problem. Then we come to past history. In this section, we collect information about the client's perception of level of health in general, and then the childhood illness, date and time, what was the type of illness previously, and what was the time. Then genogram. What is genogram? Family history of the disease which he is or she is facing or suffering from. Then try to find out the immunization status if possible, and any allergy if the client is having. Serious accidents or injuries. If these were present, then write the date. Major adulthood illness, type and date, same we will write. Then any behavioral problem that the client was facing, any surgical procedure was done with on the client, type and date. Hospitalizations, previous hospitalization, type and date, why he or she was hospitalized, and environmental hazards in the house or in the area where the client is living. Then we come to personal history. This is very important, and we should ask question very intelligently so that client can give true answers. We start from work. What type of work you are doing currently, length of time employed in the company or in the sector, and what are the stresses in the work area, workplace. Then rest and sleep. How much rest client takes, when normally he goes to sleep, when at what time he or she wake up, and it's what assistance he or she need for sleep. Everything we should ask and write. Then exercise and ambulation, whether he is doing regularly or not. And ambulation is, what is ambulation actually? Ambulation is just going for activities of daily living or walking, whether he is able to walk himself or herself, or he or she needs any help. Then recreation, leisure and hobbies. What type are there and how much, that amount is spending the time for these habits. Then nutritional history. At what time he or she takes food, what type of food she takes, what liquids he or she is taking, amount for all meals, time for all meals, breakfast, lunch, dinner, what snacks he or she takes, recent changes in appetite, and any special diet he or she is on. So everything we ask about nutrition. Then we ask for some habits like alcoholism or other drugs. If they are present, then number of years, amount, and perceived problem, that whether the client is able to understand that this is the problem or not. Use of tobacco, again, type, number of the years, and amount per day. Everything we ask and write. Then urinary and bowel activity. frequency and amount. Whether problems are there with the urinary and bowel activity or not. This we should find out and again we will write. After personal history, we go for ADL. We ask for the activities of daily living like ambulating, whether he or she is uh, getting out of bed and walking with the help or without help. Dressing with help or without help. Grooming again, whether she or he is able to do or he or she needs help in ADL. Everything, bathing, toileting, eating, using phone, doing laundry, housekeeping, preparing food, driving, purchasing food. So we touch each and every aspect of ADL and what assistance he or she needs we find out. Then psychosocial history. The psychosocial history is very important in any assessment that considers the holistic view of the client, especially in a community or long-term care setting. The psychosocial history involves the client's relationship to the others, such as family members, friends, neighbors, colleagues at workplace, and friends in social and civic organizations in the community. In the psychosocial history, we ask questions about significant stressors, coping ability with the family and other important uh, persons and groups or friends, feeling about self-care, self-concept, functional status, adaptations, independence, self-body image, marital status, etc. History of interpersonal trauma, rape, incest, abuse as childhood, abuse in the form of with the spouse or with the hands of by the spouse, other personal tragedies, everything we try to find out because these may be a hidden stressor for the problem. And while doing this, while taking this history, we can also find out the ability to discuss or current stage in the resolution. If the client is in the stage of resolution, what is the stage? Then period of grief and current status, understanding of feeling about current illness. So this is all about psychosocial history. Then we go for systemic review of the symptom. Finally, we go for review of the symptoms. The review of symptoms or review of system in terms of symptoms help the nurse to focus on each major system of the body, noting from the health history which system may have special problem. This systematic process prevents the omission of important assessment information because when we are talking to the client, sometimes we may forget to ask certain question or we may forget a system and client may also forget. So we touch each and every system that starting from nervous system, digestive system, integumentary system. So we ask question from each and every system. How? In this way. We start from the integuments like skin, hair, nails. We can ask the question to the client that whether you have any skin problem or hair problem. Then from head, do you have any headaches or any injury to the head and neck? Problem with the eyes, ears, nose and sinus, mouth and throat, neck, lungs and thorax, breast and axilla, cardiovascular system, abdomen. So in this way, point to point we ask the question, and if client will be having the problem to the particular point, then he will speak, yes, I am also having the problem in my neck. When we will ask, then he will tell, otherwise he may forget. We will also touch the musculoskeletal system, male genitourinary system as well as rectum, female genitourinary system if the client is female, neurological or nervous system, and adaptations in pregnancy if the client is pregnant. So the meaning of systemic review is to touch each and every system. Then we come to family history. In history taking, family history is also very important. This section includes interview of all family members at same time to observe the communication and decision making pattern. Assess each family member's health and also assess the family's health history. Family history also includes family members' ages at death previously, cause of death, pattern of illness and distribution across the generations like cancer, heart disease, etc. And assess family structure, whether single, nuclear or joint. Now we are at the final stage of history taking. We are going to close the chapter of history taking. What we will do, we will ask again to the client whether there is anything else that the client would like to tell or ask. Assure the client that information provided by him will be kept confidential and will be used only for health care plan for him or her. Thank you student for watching this video. For such video, you can get information by subscribing the channel My Student Support System, like Facebook page of My Student Support System, and for making your notes, just visit blogger mynursingstudents.blogspot.com. You can follow me on Twitter, Instagram, and join Facebook group Nursing Notes. Thank you. Have